Now and move on to, I would say, let's take 30 minutes for our panel discussion and involve Tomás as an expert who is here with us today, but maybe talk about a few things. I want to tell you the buzzwords and the main questions that stuck in my mind. I mean, being from Austria already, telling you pretty strict legal frameworks of how medicine works, data can be transferred, etc. I think this is one of the key issues that need to be discussed. How is this going to proceed? How is the scaling up going to work at all, with all the different frameworks, with all the different quality measurements, how you can transfer data, how the privacy frameworks are. So this is really interesting for me. What do you think about the legal frameworks in your countries, in your regions, and how can that be discussed so we can have a global impact? What has to change? What I also heard and really found very, very important to all the presentations we saw today in our health and well-being category is the questions about awareness raising, motivation of the potential patients or consumers or clients, and the communication of what you can do with your solution. How do the people even know about your product? How does it? Where is the bottleneck? Is it always the doctor? Then is it your platform? How is this going to work? Those are the key issues that I find really interesting. But Tomás, I would like to first ask you, maybe you want to tell us about yourself just briefly and your product, your connection with the WSA, and maybe one or two thoughts that maybe similar than mine, maybe not, and then we go on with our discussion.
So first of all, thank you for the invitation to be here. Yes, I started, I'm a medical doctor and the CEO of Dioscope. We started as a medical knowledge company 3 years ago. A very basic model. Before COVID, digital medical education was a little bit of a taboo, but we knew that was part of the future. We knew that with the current technology, we can have the best cardiologists in the world lecturing every student at the same time. Then we also have the problem of the locality. It's not a global world, but a local world where the local resources, they play a huge factor. So it was just as one of the solutions we were seeing, for example, in Brazil, it's not the same reality here in Portugal, and we must adapt the reality to the countries. And that was the second step of our company. We start creating a digital doctor. It's like a virtual avatar for our medical teams. And that digital doctor is basically a decision support system that is produced by those local teams, and we can promote knowledge sharing between the medical specialists and the generalists or the younger doctors that need help. We are now in the Portuguese NHS, and we can start the discussion with that, the regulatory nightmare that exists. That's why I was also asking about medical devices, because I needed to study that a lot. And regulation is a problem. We cannot take that much time to have an approval. I understand the safety of our patients is very, very important, but you cannot take 1 or 2 years to have your solution validated. It's taking too much time. And well, I can see Kadri has raised her hand, so please.
Kadri, please. Mm-hmm.
Thank you for your very inspiring case study as well, looking up to you. Thank you. But about the regulatory thing is, we are actually in the middle of changing it in Estonia, and Estonia is one of the most digital societies in the world, and it is moving so fast, the digital potential, how to really help any human. And when we are moving towards personalized medicine and personalized suggestions how to really help yourself, then this goes really deep. And in Estonia, we have this program, which I also mentioned before, called Accelerate Estonia. And when I was accepted to this program, within 2 weeks, I got meetings with Estonian president, with social ministry, and with Ministry of Education. I got the partner from National Health Institute to work out the regulations and the measurements, how to really make it, and the ethical committee as well. So private-public partnerships is something which is really needed. It cannot be done alone from the private part or from the public part. So I really am excited about this potential of having private and public partnerships to do it, because otherwise it's gonna fall short.
Thank you, Kari. Yeah, I mean, I guess you're right. You're really your country really is a runner-up as far as digitalization goes, and how you live with it and how you use it. So yeah, so I really think, Tomás, what you said with it's local, not local and not global, is that is really the tricky part. So if you're in a country where you do not have those regulations, or the government is not that open, I think I have some other people exactly also to that topic, I think, or maybe others. You want to go? Hold on, let me see. So I'm Bike. Do you want to go?
Yes, with pleasure. On a couple of aspects that you have raised with respect to regulatory, I think I can second Tomás. It has been years of battle to get through the regulatory field, and yes, I do understand, of course, that it's about the safety of the patients, but certainly globalizations and alignment would help, I think, to have an impact on patients sooner. Joe, I'm happy to see that when we move towards different geographies, that a lot of them are based on FDA approval. So once you have FDA approval, this supports, of course, in getting to further elements. Another element I like to touch upon is that I really like the initiative that is currently been taken on a European level, where we try to collaborate within a think tank approach to see how we can use data safely in secondary purposes. Because if I look at FibriCheck, we have a wealth of data that can perfectly be used not only in cardiac arrhythmias, but can support in other comorbidities and help better. And there as well, of course, it needs to be GDPR compliant, it needs to be safe. But I'm very happy to see, and we're also very happy to contribute to see how we can do this safe and effective.
Thank you so much for that contribution. Yeah, I mean, I'm next up is Sila from RetinaRisk. Yeah, how are the patients involved? I mean, how do they say yes? Let's go and let's share share me.
Yeah, I wanted to get into also the regulatory part because I think that obviously what is important is, well, trust is the key. So I think it is absolutely necessary that there is some kind of like a regulation on this, and this especially goes for when you have a novel technology that is actually adding something new to current processes or the ways that things are being done. And we can really see that our extensive clinical validation, published publications and so on, and the CE marking is really setting us apart. We can really see that, from other like wellness apps that don't have that. But at the same time, sometimes you question if there is actually higher standards put to technology than healthcare providers themselves. So just wanted to leave that.
Yeah, that's a really good point. That's true. Yeah, I mean, it's the high standards of regulation in new times, and also, I guess, of course, also lobbies of old worlds that want to keep their way of going. So if I put it that way, Sabine, I have you, please.
I don't know if Tomás wants to go first because he was so excited by the answer. No, okay. I think I have two ideas on my mind I would like to share. The first, of course, regulatory aspects are a huge challenge. I mean, the pandemic sped up things in Brazil, I imagine worldwide, because we had the need to do things in a digitalized manner. And also add that when we are talking about bottlenecks to the solutions that we are currently implementing, I think the key factor here is also access. I mean, how do you build and think about solutions that can be implemented in the poorest regions of the world, and not only for the people that have a good access to. This is a challenge for us in Brazil, because I mean, if you require an app or a good cell phone, that already excludes like a whole part of our country. So I think also we have to have that in mind of how do we make it easy and not just think about innovations that are for the top of the society, but are a game changer in all of the societies and all of the countries. I think that's also a huge bottleneck when we think about innovations on our health solutions as well.
Absolutely, Sabina. Thank you very much for that contribution. I really think so too. It is really all about access to people that don't have access. So getting access to people that have access, I mean, that sounds so weird, but yeah, you know, I mean, if you can work with counselors, and if you have, you know, all the devices, and you are in a, you know, digitalized society, whatever, it's still hard, and you still have the regulatory problem, etc., as we heard already. But granting the access and thinking about what innovation will grant access to people, so that there's even one more, you know, innovation added to the innovation. It's also the process and not only the product. That's what I mean, if you understand. Tomás.
No, I wanted to enhance that the biggest challenge is not to have a good idea, is to make that idea to have impact. Because we are here seeing 5 projects that were winners, and when you look at those projects, you understand that they could be combined, because they all have some parts that can greatly fit in others. For example, you are monitoring your patients, you are seeing if they have arrhythmias, but you also knew to talk with them, to have a questionnaire, to have the kind of approach you are having with the well-being app that you are using to screen our kids, and then you will need to have a doctor. So it's the project that we were talking about, Brazil, the BokDoc. So everything is connected, and then you will need the calculators and the risk facts, the screening tests that the RetinaRisk provides. So we are all basically part of the same ecosystem, and in this part of digital transition, we must stop working in a fragmented way, and we must understand how we can combine our solutions in a swift manner, and a manner that is not constrained by too much regulation, and that when we combine our solutions, how can we use that, our combined forces, to increase our impact? And well, I would like to congratulate again all of the winners, because they have done the difficult part, that is to create impact, to reach our patients, to reach our doctors, our schools, our kids, whatever they are trying to reach, but they have done that. And that's the difficult part, not have a good idea, but have a good project and to create the impact.
Mm-hmm. Great. You know, so I have one more question to you all. You know, having been through all the regulatory problems, legal frameworks, also kind of already obviously reaching out of your own, you know, country or region. And maybe also a question, I think we are also joined by WSA here. So where are the what you just said, Tomás, where are the combining platforms? What platforms are there, you know? And I'm not only meaning platforms, I mean who generates the frameworks, who gets you guys together? I already heard, I think, Sila, maybe was it you who said that you're talking about the EU think tank approach that you think is a good approach. Do you know where could we meet, and where could we do the thing Tomás just talked about, combine? And maybe also talking about WSA, is there a possibility of follow-up, combining platforms, ways, maybe do it in some more of a procedure, a process, where the winners can, if it's a good idea, get together and see what not only what can you learn, but how could you really work together? So all my questions again. Tila?
Yeah,
now I can hear you.
It was not me who mentioned that the EU won, but I think that's a good platform, and I think there are several ways, and I agree that it is so many solutions need to kind of like support each other, and I think actually that we will see that in the end it's going to be the patient who's going to be the center of it all. I think that we are just seeing that with the wearables and other technology, that each one of us, be it a patient or not, we are just becoming more informed individuals, and we have more means now to actually monitor our health, monitor what our nutrition does, what our exercise does in general terms, but then also if we become sick, what does that mean? I think what probably all of us are doing in certain ways is to digest this in a way. So it's not enough just to have the clinical values. You need for the patient to understand what does it mean and what should they do. So I think that we are actually moving in the direction of a dialogue. So it is more of a dialogue between a patient and a doctor, that the patient comes in there more informed and the doctor is there as a advisor in a way, rather than kind of like a monologue as it has maybe been in the past. So I actually welcome all platforms that would bring us together to kind of like support the patient, who is kind of like our goal in the end.
Mm-hmm. Yeah, well, interesting too. Ahmed, I see that you want to please join, because you haven't said anything so far, so Tomás is last.
Okay. Okay, great. I just want to talk about the same point which Tomás already introduced, about how we combine all of that and how we help each other. Here there is 2 points actually I want to mention. The first thing, when we start any startup and want to make a business or profitable business, it is so difficult to make everything in the same industry. So when we started BokDoc, we almost have about five different ideas to start with, all of them combined. We found it is so difficult to make all of that lines, different revenue streams, different business models, so difficult for one company. What we make now in BokDoc, and to support this combination and to help the community, we make partnerships. It is so easy for us. And for example, for us here in BokDoc, we now make the partnerships with the top 10 lab or radiological scans and top 10 pharmacies here in Egypt, and the same in Saudi Arabia and like that. So I help the patient to get discounts from this pharmacy and the lab and radiological scans and like that, without any revenue stream for me, just added value. We also make now partnerships with some genetic analysis in USA, and other partnerships with different healthcare partner for appointments and like that. By partnerships, it is so easy to combine and give the biggest value and the biggest impact for the community. But the same business, make everything alone, it is so difficult, so difficult. The way is partnerships. Just for example, now, for me, we are very welcoming to make a partnership with Sila, with Brazil and Belgium, and like that. All of us can help each other.
Thank you so much, Ahmed. Yeah, help each other out. Kadri, you were next up.
Thank you. I'm able to actually bridge two different worlds together. I'm working on a borderline of education technology and health technology, meaning that in education technology we already have this term of personalized education, and in medicine also like personalized medicine, where all the services have to morph around human needs. And when we are talking about ubiquitous economy, well, all the services have to morph around human needs. There comes also this really big data issue again. And right now, for example, in Estonia, we have been dealing with personalized learning paths for each student, and it has been stopping many times to regulatory issues of really getting the permissions of all the different services to act together and exchange data, how to do it in a way that it would be ciphered, so any personal data wouldn't be losing. And this is really sensitive topic, and even more sensitive on the personal health side. So I really believe in microservices and how microservices are morphing around these human needs. And this is also in a health case. But this maybe cannot be on the shoulder of one private company.
Yeah, no.
This has to even done by the world president, whoever it is, or in a decentralized way. So there is many ways of how to approach it.
Thank you, Kadri. Yeah, I think it's really something you have to wrap your head around. It's really tricky, and microservices sounds really also like a solution. And I also believe it's up to private companies very hard. How is this going to? How can this happen? You know, it's very interesting. Bike.
Yeah, I think I can align with a couple of elements raised that today the platform structure is quite dispersed, and you have often like platforms that are limited to countries. So it makes also a struggle for companies like us to always find like the right parties to collaborate with. That said, I'm completely aligned that partnerships are the key, and that joint forces need to be make stronger solutions in the end. I also wanted to touch upon the fact that I'm aligned on the fact that the patient is key. But while we got a lot of challenges in the beginning with comments that a 65 plus people, which is the majority of our user group, is not able to use smartphones, I can say now we've proven all these people wrong. They can use smartphones, but the biggest challenge on our side is actually to get the providers along and to adapt them from their traditional way of working and adopting digital health solutions. Because in the end, all these solutions need to be a relationship between patients and doctors. And I don't know whether it shares amongst the group, but on our side, we do see more challenges there than adoptions of patients across the world.
Sorry, I did not hear your last word, but I think I know what it is. So I agree totally. I think we had that in a first round already. How is that the old system or the common the known system going to adapt really, and how much is the patient in the middle there? And what are all the restrictions and maybe even the regulatory stuff that is used just to explain why it would not work in that way, so yeah. I have Nora who wanted to say something, and Tomás. Nora, and then Sabine.
It's basically just a question from the audience. Specifically for FibriCheck, how does the monitoring system work, and are there more details on its accuracy to detect strokes before they happen?
Yes.
Okay, very specific. Sorry, go, yeah.
No, so on our side, we're focused on the detection of atrial fibrillation, which is the cause of a lot of strokes, and that we do with an accuracy of plus 97%. With respect to the monitoring system, we have a whole infrastructure available that is set up in a matter of minutes, so that a doctor can follow up on his patients. This implies that all measurements are sent through close to as real time as possible, but to support physicians, as of course they are very busy and cannot always look at data, we also provide them consolidated data 1 time daily to make sure they act upon patients that needs most. And next to cardiac arrhythmias, we also capture elements like symptoms, activities after each measurement, so that doctors do know like which patients have symptoms with certain measurements and can act upon it accordingly.
Okay, thank you. Sorry, Nora, I did not look in the chat, to be honest. My mistake. I'm sorry. Guys, I see all your hands up. Do you all have your hands up again, or still to really want to, go again or go now? Please leave it open so that I go from the back. Tomás.
I would just like to add that this kind of discussion we are having is going to define the way our patients will go to interact with the system. Either it will be with micro services, so multiple apps in our smartphones. One will read our cardiac signs, the other one will talk with our kids, the other one will be used to diagnose our cervical cancer, or we will have huge marketplaces that will centralize our personal data and our health data. I don't know yet which is going to be the dominating model, but I think that in most models we will agree that we are going to be monitorized. And I think I'm a huge supporter of telemonitoring, because when you talk about strokes, when you talk about heart attacks, you do have the technology today to prevent most of those events. And using artificial intelligence, you can see that when you have an elevated blood pressure level during several days, the risk of having an heart attack is going to be elevated. So you must prevent, you must act, and you don't need to wait 1 or 2 or 3 months into the next appointment. You should act right away. So monitoring and monitoring our data is not going to be an option. It's going to be an obvious decision that everyone will follow when they understand the true impact of these solutions. If that monitoring is going to be through microservices or to a huge marketplace, I don't know, but I will assume that most of these solutions use cloud systems. So someone is already centralizing all the information. Amazon, Microsoft, Google, so they are the true owners of the data. If they are going to use their own solutions, or if they are going to continue to allow us to develop our microservices, I don't know. But well, I think this is going to be the discussion in the next years.
Yeah, true. Very, interesting and very, very, important too. Ahmed.
I actually totally agree with Tomás about that. Yes, there are some big players on the planet who have all of the data. And actually, this will be the rule, not only the government, it will be the government with the private companies. Both of them have to help in this impact and help in make this data used well and utilize it well to improve the healthcare system or ecosystem in the different countries. Actually, what I see now, after we already entered many countries and developed and developing countries, I see now from the different governments that all of governments, almost, all of them help and go very fast in these steps. And they try all of their efforts to improve how they utilize the data to take better decisions and make better healthcare industry in their country. This is actually what I see by my eyes in different countries, developed and developing countries. Just to confirm about 100% agree with Tomás.
Sabine?
Yeah, I resonate with all of the comments. I was thinking about how the challenge is, I believe, is that we bring the patient to the center, because I mean, the same woman that has to do the screening of cervical cancer also has to do the screening of diabetes and eventually has a heart disease. And I think in the data aspect, also the challenge would be how does the patient get his own data and appropriates that he should be the one in charge of his health. I mean, this is also something that we see here, because most of the data now, they stay with the doctors or hospitals, and the patient doesn't take responsibility for his or her healthcare. So that would be a challenge as well. I mean, and what you said about integrated solutions, I believe global initiatives like this one and having platforms where we can exchange experiences are very important. Also, for us to have better data, I mean, so that the cervical cancer data that we have in Brazil is not focused on our own community and only works here, because our artificial intelligence will be completely biased, or the retina analysis doesn't use only the population in Europe. So I also believe that we need that to have a better solution in all of our solutions here and other platforms. So we're very open in our project to apply any of your solutions if we see it's possible, because we get to the people. I think that's the hard part, to get to the patients. And once we do that, we can optimize what we are doing with the patients once he's there. I mean, we should use that moment the best we can. That's my thought.
So, I have Sila one more time. I want to just tell you a few things that, went through my mind, and some experiences that I have with our large association that we're running here in Vienna. Very, very nice city, very rich country, very beautiful city. I don't know if you've seen it before, but I guess you probably have heard of it. So we've heard key is access, trust is access, access is the key. I'm sorry, let me go again. Access is the key, the patient is the key, trust is the key. So we have heard a few keys. And then from my point of view, just one thing that I'm seeing. So I know starting from Vienna, a global initiative that is about digital humanism, or how digitalization can be humanized. I employ over 1,500 nurses and social workers and helpers in our company, in my company that I'm the CEO of. So I have 700-800 women that do home care, that are sometimes trained nurses, but sometimes not. And they all have to work with the PDAs and the devices, and this is how they care for the patients. I can only tell you what I see. So the very high level that we're on here, seeing all your products and how great they are and how they work with the devices. I can only tell you, I don't even know in Austria, in Vienna, how I'm going about training my staff to be able to use that. So I hear from the staff for the Clanbeat, the teachers that are supposed to work with the kids in Estonia. Okay, really high level digitalization in your population probably. This is the only thing that I want to really add to. How is the labor force? How is the staff? Even the staff going to be relatable to this fast digitalization? How am I going to train as a employer of more than 1,500 people in a rich city? I don't know how to do it. It is really hard. It is going to take me years, and I'm running for all the finance and the money so I can have the right devices, the right people that they can work it, the training on the job so they can do it. And I have, I guess, like in lots of other countries, especially in Europe, really, the labor force is just not here to do the jobs. So for rounding up, I just wanted to tell you my perspective on digitalization in education and health, and how we need the people for it to work it, to bring it to the people, and how access is the key. That is just that's my mission. How can I train the people to follow digitalization, to work it? I'm not even with the legal framework here. I'm just basically, how am I going to work it? Sila, how am I going to work it?
You want a simple solution. Well, I think the points that you make are very important, and I think it was also made before that it is going to take a time. I think there are three things I would actually say. And I'm actually referring to a use case that we've been integrating RetinaRisk here in the hospital, National Hospital in Iceland. I think there are three things. Like you say, the attitude of the healthcare providers, they need to see that there is actually benefit in adding or using this solution. So I think that is kind of like number one, that we need to be able to show those who are going to be using it why it matters, why it helps with the clinical outcomes, how it frees up some hours that they can actually focus on high-risk patients, how it can actually automate processes. So I think that is all very important, that we need to have champions in a way within the healthcare systems who are helping us driving this. In our case here, funding has definitely been an issue, and in this particular case, we had actually governmental grant to help us to implement the solution. So that is kind of like another aspect that we always need to look into. I think third is that we as the companies, we need to be very flexible. We need to also listen to the users. We can't just have like a solution that we believe is like this without listening to how does it work with your stuff? What is it that your stuff needs? We need to understand the pain points. How can we adapt our solution to what your stuff needs? So I think these are kind of like challenges, but I've also seen with RetinaRisk that we have actually managed to go about it. I think collaborating, partnering with healthcare providers to fully understand what are the pain points and how can we actually help them in so many different ways. I think that can like lead to very successful partnerships and leading us toward this, that we are actually empowering the patient. Because I think for the time being, it's so true that has been discussed that not everybody has access to these digital health solutions now. I agree also that age does not always matter. I think actually, like here in Iceland, the older population is very interested in these new technologies, but it all takes time though. And I think that we need to have the healthcare providers with us on this journey towards the empowerment of the patient.
Thank you. Yeah, feeling better already. No, it's great. So I have Sabine and Tomás, and then guys, we have to stop. We've reached the end. And you have, your famous last words from Sabine and Tomás, please.
Thank you. We're very focused on this aspect. We strongly believe that the skill set to use this technology is different from the skill set that traditional health workers have. It's completely different. So it's kind of what we are planning, and we strongly believe is that we need a new profession. It's like a technical intel-health that knows technology and is able to turn on and off the devices and knows how to use the camera and has the ability to use the apps. And he will help the doctors and nurses, because this is a big challenge. And it's a whole new world, and maybe asking and forcing traditional health workers on using that, it's a huge challenge that maybe can get the whole process delayed. And we see that as a strong possibility here in Brazil, especially, that many of the health workers that are on the field have a lot of challenge with technology. So we are aiming at that, and we think that could be a solution in the future.
Thank you. Yeah, that's very interesting. I've been thinking about something like that too. I'm kind of a translator, like an in-between thing, person, profession. Tomás, do you want to round up with me?
Yes, it was what Sabine was saying. I don't think it's going to be a physical person.
Okay.
I think it's going to be a digital assistant. And I think that's part of the solution. So it's not just about empowering patients. It's just about to empower the healthcare professionals that are around those patients. So we were talking about home care. Home care is an obsolete model these days. Using the technology that we have available, we can monitoring those patients with our solutions, and then when there is some deviation, then your home care team will be called, and they will have a digital assistant helping them manage those alarms. Some of those alarms will be automatically managed, and only when you truly need your workforce to be at those home care patients, only the true red flags will be necessary to deploy your workforce. So your workforce will be able to just not assist 1,000 patients, but probably 10,000 patients with the same number of employees. And that's the big game challenge here, is how can we use technology to improve the access of our patients to proper healthcare. And well, I think that's the biggest challenge, and I think that's the big value of the solutions we were discussing here, because they do that. They have proven their value, and they have proven they can, with technology, improve access to proper healthcare.
Tomás, thank you so much.